Good evening, and thank you for joining tonight's live town hall meeting hosted by Douglas County. We'd like to welcome all of you who showed up in person and the dozens of you joining already online and on the phone. Tonight's live town hall topic is close to my heart. We're going to talk about mental health. In 2014, after a series of tragic events in our county, I was the county coroner at the time, so I know these stories very well. We, Douglas County, came together and established the Douglas County Mental Health Initiative. Today, that initiative is 40 partners strong and capable of providing our community with hundreds of mental health services for both youth and adults. Tonight, we'll hear more about the progress and future of our Douglas County Mental Health Initiative and get your input on how we might invest some of our ARPA dollars to further these mental health services. Our county is set to receive $68.2 million in American Rescue Plan Act funding from the federal government. Last year, as a community, we decided on 5 core investment priorities: broadband, community recovery, economic recovery, mental and behavioral health, and water and wastewater. Several proposals for this funding have been submitted. You can find all the details for them at douglas.co.us/ARPA. That's ARPA. Tonight we'll talk specifically about the proposals related to mental health. We hope you'll stay on with us for the next hour. Commissioner Layden.
Well, welcome everyone, and again, thank you so much. I just wanted to speak from the heart to those in the room and online. You know, mental health is near and dear to the focus that the county often has as it relates to all adults and young people in our community. In particular, I'd love to just start the evening with some good news. We often talk about the tragedies and difficulties associated with mental health in our community, and I'm really excited to share with everyone the rollout of the new 988 National Suicide Prevention Hotline mid-July. It started out as federal legislation 3 years ago with Senate Bill 2661 that passed October 17th, 2020. The companion legislation in Colorado, Senate Bill 154, passed June 28th, 2021. I was fortunate to have been appointed to the State Planning Committee, and we are now rolling that out for the entire state in a way where people facing mental health crisis will be diverted from jails, diverted from ERs, and be able to receive that confidential mental health resource that is so critically important. Douglas County was a critical funding partner to ensure the strong launch of 988, so we're thrilled that that's coming forward. So there's several other proposals that we're talking about tonight with regard to ARPA. I'll turn it over to Commissioner Teal to share a little bit more.
Well, thank you, Commissioner Layden. Like Commissioner Thomas mentioned, we have been working in partnership since 2014 to address mental health system gaps here in Douglas County. Today, we know mental health continues to be a priority for our community. During our public health assessment that we did over the last year, we heard our community say mental health is one of the top 3 public health concerns. Tonight, we will hear about several proposals to help meet that priority, proposals related to a crisis stabilization unit, expanding our police department's community response teams, and for veterans mental health services, which I'm sure everybody knows is a very important topic for me. We will hear brief presentations on what these proposals would provide, and then get your feedback and any questions that you have. So to get us going, here's our moderator, and he has the details on how you can participate. Roger, take it away.
All right, thank you, commissioners. It's really easy to participate. To ask a question, press *3 on your telephone keypad, and you will be transferred to an operator who will take down some basic information. Once the operator notes your information, you'll be returned to the call and can listen to the conversation until it's your turn. Since we'd like to hear from as many people as possible, please limit yourself to 1 question or short comment. When it's your turn, I'll call your name and ask you to repeat your question for our live audience. So again, *3 to get in line to ask a question or make a comment. If you are participating online, or if you would like to participate online, visit douglas.co.us town hall. You'll be able to submit questions there as well. So Commissioner Thomas, let's kick it off.
Thank you, Roger. Let's hear briefly from Douglas County staff about these proposals. We will hear about one proposal at a time, followed by questions from you about that proposal. After all proposals have been discussed, we'll get your thoughts via a polling question. With time left, we'll take additional questions. Let's start with an overview of what would be a brand new program, a walk-in crisis center and a crisis stabilization unit. Laura Cinconi.
Thank you, Commissioner. Good evening, everyone. I'm Laura Cinconi. I coordinate the Douglas County Mental Health Initiative. And I'll get us started off with the walk-in center and crisis stabilization unit proposal. The proposed investment is $1.8 million. This will cover startup costs and operating expenses for the first 6 months of operation. All Health Networks, a community mental health center that serves Douglas County, has proposed the establishment of a behavioral health facility in Douglas County, and this would consist of a walk-in center for all ages and a crisis stabilization unit for children and adolescents between the ages of 5 and 21. This would be the first of its kind facility in Douglas County and would address known youth mental health needs. For example, Children's Hospital Colorado declared a pediatric mental health state of emergency in May of 2021, and across their network, emergency department visits for mental health services for youth went up 90% between 2019 and 2021. Community-based crisis services for both youth and adults in Douglas County are sparse. Currently, adults and youth, to access the closest walk-in center, have to get to Littleton, and the closest crisis stabilization unit for youth is in Aurora. So it's very critical that these services are closer to home for Douglas County citizens. Following the first 6 months of operation, All Health indicates that the facility would be funded by Medicaid revenue as well as supplemental funding from the Office of Behavioral Health. And as partners in this endeavor, staff at Douglas County will go one step further, and in partnership with All Health Network and the Douglas County Mental Health Initiative, coordinate a community-based mental and behavioral health continuum of care that we intend to support individuals accessing the walk-in center and crisis stabilization units, so they're wrapped in support following their stay there.
Laura, thanks so much for that. So Roger, do we have folks on the phone with questions about this proposal?
Let's start with a question from Xenia. Go ahead.
Yes, my question is, my granddaughter has been here from Alaska when she was living with her mom, and she's been here in Parker with me for about 3 months. She's been in a behavioral health hospital 3 times since she's been here. I'd like to know, she's currently in a behavioral health hospital, and she's going to desperately need help again once she's discharged. Are there any resources that will help? Because I'm hoping that this particular hospital will send her home with medications and resources, but thus far the other hospitals have not done that. So is there some way I could reach out to someone to assist us with this?
Xenia, thank you for that question. I'll turn that to Laura, or really anyone on the panel, I saw.
Hi, everybody. This is Jen Bach. I am the Chief Clinical Officer at All Health Network. All Health Network is a community mental health center that Laura also mentioned. We serve both Arapahoe and Douglas counties. So to answer your question, thank you for your question. There are many services available across across the Denver metro area. Specifically in Douglas County, All Health Network offers a whole variety of services to support youth and families across the continuum and can help with services post-hospitalization, so including ongoing medication services, therapy services, and so typically when someone's in the hospital, they will coordinate a discharge for follow-up appointments, but in the event that they don't, you can contact us directly to schedule an initial appointment.
Jen, thanks for answering that. And Zenia, again, thank you for your question. So we do have this question that came in online from Sue. Her question is, why do we need a facility like this in Douglas County? Who would like that?
This is Jen back again, and since the proposal came from All Health Network, I'm happy to answer that. Currently, there is no crisis stabilization unit or walk-in center in Douglas County, so as Laura mentioned, folks have to travel pretty far to get those services. Adding a walk-in center, and this would serve all ages across the continuum, regardless of insurance. So if someone has insurance, great, and if they don't, that's okay too. And the purpose of a walk-in center that's different from a hospital is that we are staffed specifically to work with individuals that are struggling with behavioral health crisis. So our staff are used to working with folks struggling with crisis and can help assess, make a plan, and get them to the next step. Additionally, for the crisis stabilization unit, there is a significant lack of beds for our youth within the state of Colorado. And so the idea would be to add an additional crisis stabilization unit right here in Douglas County that would serve our youth. It would be a program that is really focused on families, so supporting the youth, but also a plan for families following their stay so that the youth and the family can be successful as the youth integrates back home, into the community, into the schools. So both of these programs would really help to expand the continuum of care across Douglas County for youth, families, and adults.
You know, just to have more of a conversation, Jen, I know when the commissioners met with the directors of Children's Hospital or the leaders over there, we asked them if they could wave a magic wand, what would you do? And they said really outpatient therapeutic crisis stabilization for youth. And they talked about, you know, if you have a child with suicidal ideation at 4 in.the morning, there is nowhere for them to go. Some citizens might say, well, what about our emergency rooms and our hospitals? Do you want to distinguish between ERs and what you're talking about?
Sure, happy to. So again, in the emergency rooms, the difference with the walk-in center, again, is that it's really geared toward helping people specifically experiencing a behavioral health crisis. That's our bread and butter. That's our focus. That's the staff training in that facility. And so our goal is to help youth in the middle of the night find a place. Sometimes it's providing crisis stabilization, and then they're able to go home. The hope is to prevent that longer-term hospital stay and reduce the amount of time kids are out of the home as much as possible. So it's really, the difference really is that it's focused on how do we help people specifically experiencing behavioral health crisis.
Well, that's awesome, Jen. I spent the afternoon touring the new All Health facility in Castle Rock. We're really excited about that. So before I turn it back over to staff, I want to remind you to press *3 on your keypad if you'd like to ask a question. You can also participate online at douglas.co.us/town hall. Now I'd like to turn it to staff to talk about the Care Compact.
Thank you, Commissioner Layden. This is Laura Cinconi again with the Douglas County Mental Health Initiative. The Care Compact is an existing project of the Douglas County Mental Health Initiative that formally links existing care coordination services, case management services, those providers through a streamlined network of to serve the most vulnerable and costly individuals in the community, those involved with multiple systems of care who have complex mental health, substance use disorder, intellectual and developmental disabilities, and significant issues accessing or caring for their basic needs. People with serious mental illness or co-occurring disabilities, they tend to have difficulty meaningfully engaging in treatment due to the challenge of navigating complex and fragmented systems of care. And typically when their basic needs haven't been met, those take precedent and can kind of overshadow those other healthcare needs. So it's really essential to have a coordinated, effective, efficient system helping those individuals. The Care Compact meets whole person health needs by coordinating all of the entities that are involved, from hospitals to our co-responders to intellectual and developmental disability serving organizations, substance use providers, together in a network supporting the individual in their person-centered care. The proposal for the Care Compact would be an investment of about $3.7 million over the course of 3 years. And it would allow us to increase network capacity to serve more Douglas County residents needing this enhanced support. This includes meeting capacity to respond to the referrals that we expect to come in from families and individuals who can now self-refer to the program, seed funding for partner organizations to dedicate staff specifically to manage Care Compact clients as the caseload increases. We also would like to develop a Care Compact for youth and families, and this would be an example of a program that could support youth and families utilizing the Walk-In Center and Crisis Stabilization Unit. We're interested in evaluating the impact not only to the behavioral health system of care, but also what this program means to individuals and families, and also some dedicated funds to support individuals who may be experiencing barriers to accessing care. Commissioner Teal.
Thanks so much, Laura. Appreciate that. Let's go ahead. I want to go to a couple of, actually, before I take a couple of questions, want to remind everybody, go ahead and press *3 on your keypad if you'd like to ask a question or share your views with the panel. I'm going to call an audible here because I just got a question in on Facebook Messenger, and it comes from my Facebook friend Brian, and he asks a great question. How come the county is involved in the coordination of an individual's private health care matters? And Laura, I wonder if you could get us a start on that, and then actually, Jen, maybe you can jump in again too.
Happy to get us started on this. So that's a really great question, and I think a good point of clarification for the role of Douglas County and the Mental Health Initiative in general. So the Mental Health Initiative, or the role of the county in this collaborative, has been, since its launch in 2014, to be a convener. We are what we call the backbone of the Douglas County Mental Health Initiative. So in other words, we provide that platform where collaboration among community partners who provide the services can occur. So we understand that those service providers are experts in what they do, and the county is really here to facilitate the collaboration, the development of programs that meet the needs of the community. So we really are not involved in healthcare, but we work with our community partners and enhance the system that is there for the benefit of folks in Douglas County.
Okay, thanks, Laura. Jen, did you want to jump in a little bit more on that one?
Just to add that when people are experiencing a severe illness, regardless of the illness, but today we're talking about behavioral health, it can be really taxing on families and the individuals. And so having help from providers such as the Care Compact and the individuals that know the services well is meant to be a resource to lift burden off of the people experiencing crisis. And from experience and from conversations that I and others have had with other counties, Douglas County is really ahead in this area. This care compact really has made a difference for some of our folks that would traditionally fall through the cracks. And so it's a great service that we need more of.
Outstanding, thank you. And I kind of laid you guys up on that one because obviously Brian asked the question of me on Facebook Messenger, but Brian, I'll tell you, this was, a few of my colleagues know, several other people know, my time before coming onto the Board of County Commissioners, I was on the Castle Rock Town Council, and we didn't do this. We didn't have this public health, mental health interface, and it really comes to what are the responsibilities of counties under the decentralized administration of the state of Colorado. And so it was something I had to learn, and I think, Abe, I think I hit you up in the hall once saying, why are we even talking about this? And yet it is a responsibility that the county has, and I've been, for one, I've been really pleased to see what we've done, the work we've done with the Care Compact that Laura just talked about, as well as a couple of these other programs you're going to hear about this evening. Hey, Roger, I want to check back with you. Do we have anybody on the phone? Well, let's go ahead. Folks, if you're on the phone, please press *3 on your keypad in order to join in. And let's go to a question that was submitted earlier online. And Jamie asked earlier, how would expanding this program impact me and my family? Who would like to take that one?
I'm happy to take that, Commissioner Teal. Thank you. This is Laura Cinconi. What we're proposing in this expansion of the Care Compact is really increasing capacity to meet a growing need in the community. We have received so far in about a year and a half 57 referrals to the Care Compact. And as I mentioned, the folks in this program have some of the most significant needs. So the systems involved in the care of this population are really strapped in terms of times and resources to coordinate care. So it is necessary to add additional staff, expand our IT infrastructure, which I will talk about later this evening. But really the expansion and added capacity will mean that we can serve more individuals in the community, ensure that they're connected to the services that benefit them.
Awesome. Thank you so much, Laura. Well, shifting from the Care Compact to something that actually I do know a little bit about, and due to my time in Castle Rock, because we're going to talk about a program that actually Castle Rock participated in. We've seen participation with Parker. We're just starting, well, hang on, probably shouldn't do any spoiler alerts in talking about the next municipality coming on, but going to talk next about the community response team expansion proposal that we're considering.
Thank you, Commissioner Teal. My name is Maggie Cooper. I am the CRT coordinator for Douglas County, and I'm going to talk about the CRT expansion that's being proposed. For anyone who is not familiar, the CRT, it's the Community Response Team, is a co-responder program which pairs a dedicated law enforcement officer with a mental health clinician in a car together 40 hours a week. They respond to mental health and non-criminal substance use emergencies. Additionally, we have a case management component in our program, which offers connection to resources quickly with the help of case managers on staff to ensure that people who have had CRT contact are linked with the appropriate mental health resources and supports to help them longer term. We are requesting $300,000 in one-time funding and $357,500 in annual ongoing funds. The annual ongoing funds will be utilized to staff additional teams with clinicians and case managers and for the operational costs that are associated with running these teams. Our law enforcement officers are funded through in-kind donations from our law enforcement partners So the one-time $300,000 is being requested to help offset the cost of equipping these officers with the vehicle and other necessary supplies that they utilize to respond to these calls. Our CRT program launched in May of 2017 with one pilot team at Castle Rock Police Department, and today we are just days away from launching our 5th team at Lone Tree Police Department. The current makeup of the program is one dedicated team at both Castle Rock and Parker Police Departments, and our partners at the Douglas County Sheriff's Office have a dedicated team just like those at Castle Rock and Parker, but they also staff our specialized youth CRT, which responds to calls originating in our Douglas County schools, and those are district, private, and charter schools that have access to the CRT response. Lone Tree Police Department, who has always been a referring partner, launches a full-fledged dedicated team at their agency this coming Monday, May 9th. Additionally, just this week, in partnership with the Douglas County School District and us here at Douglas County, we secured funding to add a second youth-focused team, enabling us to provide a CRT response in every single school located within the county. By receiving these ARPA funds for CRT expansion, we'll be able to add additional community teams at CRPD, Parker Police Department, and Douglas County Sheriff's Office, which will enable us to have a CRT response 7 days a week here in Douglas County. Commissioner Thomas?
Thank you. Roger, do we have anyone else online yet?
We do. We have a question from Aaron. Aaron, go ahead. You're live.
Hi there. Hi. So it looks like we'll be taking a step back on topic for a second here, but thinking of the walk-in stabilization clinic and that whole program, could you walk us through the progression of care? So say a person in crisis goes to the walk-in or stabilization clinic. They get the care they need there. Once they're discharged from there, though, what does the path of care look like? And is that part of this program? And to piggyback on that, is the funding for the program sufficient to support the follow-up that's needed? And do we have the providers that we need to support that caseload?
Okay. Thanks for your question. This is Jen Bach again from All Health Network. So I'm going to try to get to all pieces of your question. So the way that this would work is initially we would start with the launch of a walk-in center, and then the following year, the development of a crisis stabilization unit. When someone enters the walk-in center, they meet with a crisis counselor, they receive an assessment, and then a plan for next steps. Sometimes the next step is a need for placement into an inpatient level of care. And that can look like a hospital, an acute treatment unit for adults, a crisis stabilization unit, or other residential facility for youth. Our clinic, our team, helps ensure that the person gets to that right level of care, whatever that means. Then we also follow up once someone leaves to check in and connect with them to see how that all went for them. Where they go following placement is up to their next step from the walk-in center. So if an adult goes into a hospital setting, then the hospital works with that person on discharge and next step. Once we have the crisis stabilization unit and a person has been assessed, a youth has been assessed and then admitted to the crisis stabilization unit, our team provides counseling, could be some medication services, could be peer support, groups, so a full continuum of care within that crisis stabilization unit. Part of that work is discharge planning and determining next steps and connection to care. The funding that we're requesting helps us establish both of those units and get operations up and off the ground for the first 6 months. Your question then about what are the services available for follow-up and outpatient is a great one. there are several different clinics that provide outpatient therapy for youth, families, adults, case management, et cetera. And the funding we're requesting does not support that. And the need to hire is continuous. We are continuously working on meeting the demands of the community. Thank you, Jen. I'd like to remind everyone to press *3 on your keypad to call in with a question. I have a question for the officer who's here on the panel, the deputy sheriff. Marion has reached out and said, from an officer's perspective, how does the community response team help with responding to calls? What benefit do they provide officers and our community?
This is Deputy Zac Zapesky. I'm on the patrol community response team. Sorry. I've been in law enforcement for probably over half my life, and this is the most impactful team I've ever had an opportunity to work on. To be able to, I'll put it simply, if people are calling law enforcement, they have an emergency. We're not the people to decide if a behavioral issue or a mental health emergency is something that we respond to or not. We're going to go. So to be able to show up with my clinician and provide a different level of care that maybe just your normal patrol officer wouldn't be able to provide is something I'm really proud to do. I'm able to show up on a call, and once we establish it's not criminal in nature, and to be able to relieve my fellow patrol officers and allow them to go back to the streets and do what they need to do, I get to stay as long as I want. I have great supervision who tells me that I need to stay on the call. I need to make sure that it's done to the best degree. And it doesn't matter if that takes 5 minutes or 2 hours. So it benefits the officers to get back on the street and go back to what they need to be doing, and it benefits the community because we get to show up and provide a different level of care, whether that be transport to a facility or establish case management for that family.
Thank you, Deputy Zapesky. Let's have staff talk to us a little bit about suicide prevention, because that's another broad project that we really want to focus on in Douglas County.
Thank you, Commissioner Thomas. So the suicide prevention grant program that we have proposed would be an investment of up to $1.5 million, or between $250,000 to $500,000 distributed over 3 years. There has been an increase in emergency department visits for suicidal ideation and suicide attempts among adolescents between 10 and 18 years old between 2019 and 2020, and among adults aged 19 and older. Suicide data is something that we have been monitoring for several years, but have paid close attention to over the last 2 years throughout the pandemic. And although, at least in Douglas County, we haven't seen an increase to the baseline overall number of deaths due to suicide, it is important to consider these other data points that demonstrate risk in the community. So looking at emergency department visits is one example. We also have data from Colorado-based surveys through Healthier Colorado and the Colorado Health Foundation that found that 53% of Colorado adults reported worsening mental health as a result of the pandemic, and 46% of surveyed adults expect to experience long-term mental health impacts as a result of the pandemic. So it's important that we invest now, consider these statistics, take them seriously, and suicide prevention is one opportunity for investment to do that. Effective suicide prevention requires multiple approaches with a focus on building protective factors and reducing risk factors in a community. And the proposed investment would be a grant program for evidence-based, research-informed, promising practices and innovative approaches to suicide prevention. We've intentionally written the proposal quite broad to allow for as many proposals as possible. So it would cover, we would consider proposals in the areas of mental health promotion and prevention, treatment, intervention, recovery, and postvention. Commissioner Layden?
Laura, thank you for sharing that. And, we know that suicide is the second leading cause of death between the ages of 10 and 34. You just look at the Colorado Suicide Dashboard, and there's a real peak between the ages of mid-30s to about 54, and it tends to be suburban males. I know I'm not alone in knowing a lot of people that struggled during COVID. I lost 5 people to suicide during that time, but I know a lot of people, and I know I'm not alone in folks that have seen that kind of devastation. So thank you for your work in that arena. I'm glad we're having the conversation. We have some really special people here in our audience tonight, and I just want to make sure that we introduce them. We have Suzanne Burkholder from our library board here with us this evening. We have Chief Duffy from the Douglas County Sheriff's Office, and we have Director Dan McKelkey from our Department of Human Services. You're here with us. Would any of you care to share anything with us about this important topic of mental health? Okay. Well, I just wanted to acknowledge each of you. You're tremendous community partners, and we appreciate you. So we'll move to, we do have a written question online that we received in advance regarding suicide prevention. And this one came in from Diane. Suicide prevention feels like a very broad area. Can you give me some examples of how this funding will translate into actual action?
I'm happy to take that. Again, this is Laura Cinconi. I agree. Prevention and suicide, big topics. So I want to break down a couple of examples in the areas that I mentioned. So if we're talking about mental health promotion and prevention, this could look like workplace wellness initiatives, community education, stigma reduction campaigns. The library could be a great site for activities like this. For suicide prevention, those kind of research-informed, evidence-based programs. A big one in Douglas County right now is Sources of Strength. It's a school-based program, and if there's any curiosities about that, we have our Director of Mental Health from the school district here who can speak to that. Programs that promote connectedness, community safety, resilience. Clinical services would include expanding treatment programs, for example, and if we're talking about post-prevention and recovery, building capacity to respond to suicide attempts or suicide deaths. So if there's been an attempt, this could look like re-entry into the school or workplace.
Laura, thanks so much for that. I'd like to turn it back over to staff to talk a little bit more about a different program, which is Veterans Mental Health.
Thank you. So Veterans Mental Health, the proposed investment in this area is $333,000 over 3 years. And why Veterans Mental Health? In 2020, the Colorado Office of Behavioral Health Needs Assessment identified veterans as a priority population in Colorado. And there are about 20,000 veterans currently living in Douglas County. And the data for suicide in the veteran population shows that about 16% of all suicide deaths between 2004 and 2019 in Douglas County were among veterans. Veterans also have a higher rate of suicide than the general population and are less likely to access mental health treatment. When we look at the settings where veterans access mental health care, outpatient mental health centers are in the top 3 for providing behavioral health services in the county, but currently our community mental health center does not have a dedicated position to serve veterans. So that is something that is built into this proposal. So the proposal is a collaborative of Douglas and Arapahoe counties and our community mental health center All Health Network. And there are 3 components. One is that specialized position that I mentioned. So that would be a brand new veteran-specific peer position to serve veterans who have mental health needs through the community mental health center. A part-time Douglas County Veteran Service Officer whose primary role would be to design and implement strategies for veterans' mental health promotion and suicide prevention. And this role would also act as a liaison between the County Veteran Service Office and All Health Network. Finally, one of the recommendations in the Office of Behavioral Health Needs Assessment for organizations that serve veterans is to implement specialized training to equip those professionals with skills to respond to veterans in crisis. So we have also proposed funding mental health first aid, the veteran module, for the 8 veteran service officers between Douglas and Arapahoe counties.
Awesome. Thank you, Laura. So you touched on something that brought in a really quick text from a friend of mine named Nick. Nick's a Marine Corps veteran, so of course I'm surprised that he could write. He responded, don't worry about it. I kid, always appreciate our Marine Corps brothers. But Laura, so Nick did ask a very important question. Why would a veteran get services from All Health and not the VA? Oh, Jen, by all means, please.
Hi, this is Jen back again. So what we would be able to offer at All Health Network is anybody regardless of insurance. So a veteran who has TRICARE insurance or no insurance could seek care from us.
Okay, thank you. Actually, he likes that answer. He didn't like my preamble, though. Okay, well, very, very good. Thank you, Jen. Let's go ahead and like to go ahead and pass it next and talk about IT support.
Thank you, Commissioner Teal. This is our final proposal for this evening. This would be the expansion and enhancement of the case management software that we use for the CRT program and Care Compact programs to support expansion. The investment is $410,000 or $120,000 annually for 3 years and a one-time $50,000 investment. So Gelota provides the case management platform for these programs. We also use it for data collection and reporting. The benefit of this platform is being able to bring in data from multiple sources, but we can also use it as a central place to communicate securely about the clients we serve. So given the interest in expanding the community response team program and onboarding multiple partners to the platform for the purposes of care coordination through the Care Compact, we do anticipate increased caseloads, and so we would need enhancements to the system to effectively manage additional clients, make sure that we're up to code with privacy standards, accommodate the growing network of partners utilizing the platform, and make sure that we have access to the best data so we can demonstrate the success of these programs. So the proposal would cover the cost of the software itself and integration with other systems for improving information sharing. Commissioner Thomas.
Thank you, Laura. We have an online question from Gabby. How can you link all of these systems and still support my privacy?
That's a really, really great question. So the platform is compliant with HIPAA, which is privacy standards for healthcare information. It's also compliant with protecting information related to substance use disorder and treatment for substance use disorder. There's also really excellent filters within the system. So let's say Deputy Zapesky and his clinician are out on a call. He could see information related to specifically to the call, but he wouldn't be able to access any clinical information. So there's ways that we can filter information in the system. We also have releases of information, so we are, especially in our care coordination program, seeking approval from the clients that we serve to share information. So we definitely take that seriously, and it would be a part of our enhancement to the system moving forward to make sure that we're in compliance with privacy standards.
Well, people seem to be interested in this question. We have another question. How will this help me receive help and care faster and easier?
Well, we hear a lot about people having to tell their story to lots of different people, and it can become kind of exhausting to relate that, especially if we're talking about mental health and behavioral health. So systems like this that coordinate information can just reduce that burden on the individual to have to repeat their story. It allows folks in the system of care also to communicate more effectively, to work on shared care plans. So we're really just trying to make sure that the clients have the quickest, most efficient access to the services they need. And I think Deputy Zapesky, I don't know if you wanted to add something to the last question.
Just on faster and easier, this system, if we're able to look in the system, if I'm working and we're able to look in the system and see if we've had previous contact with them or kind of what the situation is, it changes our response to where we can go from certain patrol deputies going out to where maybe it's just my team going out. So we're able to reduce the amount of people that are there or even just the type of response in general. So rather than have to go through and explain to 3 different cops what's going on, perhaps they already know me, or then they only have to tell my clinician and I their story.
So are we to the point in the program, Roger, that we have some polling questions?
We do indeed, and it's easy to participate. All you have to do is use your telephone keypad to enter the number of your response, and if you're participating online, just click your response. Here's the question. Based on what you have heard tonight, do you agree these proposals would positively contribute to the mental health work the county is already doing? Press 1 if you strongly agree. Press 2 if you agree. Press 3 if you're neutral. Press 4 if you disagree, and press 5 if you strongly agree. We'll report on the results after we take a few more questions. And Commissioner Thomas, I think, or Commissioner Layden, I think we've got a question here in the hearing room.
Great. It looks like Suzanne from our library district may have a question. I'll walk over with the microphone. Thank you for being with us.
Thank you. Thank you, Commissioner Layden. I wanted to thank all of our community leaders here for building both the systems that support mental health as well as the resources required to support that mental health. So my question is, as a member of the community, how can we help to bring awareness to the abundant resources that are available out there, and how do we bring them to the people in need? Thank you.
It's a great question. Who would like to take that?
Well, I'll get started with it because I think one of the first ways we're trying to do it, Suzanne, is this. Holding this town hall. And just a reminder, we've got folks that are on the phone right now. We have folks that are joining online. But it is our intention to go ahead and have this as a recording. And put it up on our YouTube channel here in the county. And actually here in the next few weeks, we're actually going to be launching an HD channel with Comcast. And so have it running as a part of the programming there. So that's the number one start. And that might be the stupid answer to the question, but I'm good for those. So that's our start. Would anybody else like to speak in a little more detail than that, though?
I would, and this is Dr. Jim Barofio. I'm going to speak very globally just for a moment and lead off with the fact that, or the observation that CRT has been a remarkable contribution to the community. And I think in part that is driven by our ability to provide support services within the community setting. I think in addition to that, there is sort of a natural destigmatization that occurs by virtue of delivering these services in the community. So what I would say is, in response to that question, I think it's incumbent upon all of us as community members to destigmatize mental health issues, consider mental health issues in the same vein as we would consider physical health issues. People need psychological health plans as well as physical health plans. So I think as we encounter members of the community and we develop our programs, that we continue to emphasize this destigmatization and a universal support for all of our community members.
Thank you, Dr. Barofio. We certainly appreciate that answer. And Suzanne, thanks for the question. You know, we did receive an online question from Janelle. I think it's a good one, which is, what can I do today to support someone in my life who's having a hard time with their mental health? And Jen Bach's got all the good answers tonight.
If I could just get proficient with the mic. It's a great question. When someone that you know seems to be struggling, and that can look a lot of different ways. That could look like somebody's behavior's changing, not participating in the same kinds of activities, sleeping more, sleeping less, eating more, eating less. Sometimes saying, I want to die. And that's the most blatant. Whatever it is, the biggest thing you can do is reach out and be available, to open the door, to express that you care and that you're there to listen. One of the biggest myths out there is that if we ask someone if they're thinking about suicide, we're putting the idea in their head, and it's not true. Asking somebody if they're thinking about suicide can open the door to further conversation. It reduces stigma, and it validates what they might already be experiencing. So I think the answer is be there, open the door, express concern, and if they need help, help them get connected.
I'd love to ask the same question to Dr. Crawford from our school district. You know, one of the 15 boards I sit on is the Douglas County Youth Initiative, and we've talked about taking Youth Congress on the road to high schools to talk directly to young people about these issues. Is there fear, to Jen's point, that if you say the word, the phrase mental health, that you're triggering something, or is it good for us to talk to young people about mental health and suicide?
Yeah, well, thank you. And I couldn't agree more with Jen. You know, the best thing that anyone can do is make connections with others, be there, have open conversations, and learn about mental health, learn about the signs of people who are at risk, and talk about it. It's okay to talk about it and offer support. And every single person can be a helper and a hero. It just takes your willingness to be present with them and be able to ask tough questions and link them to connections. In the schools, we really, really value talking about all aspects of a child's well-being, including physical and mental health. And in our schools, I'm really proud of our youth. We've worked hard, and they don't feel the same stigma that maybe us adults do. They're very open to talk about their mental health. And we take a strengths-based approach. So we talked about suicide prevention, and one of the programs we use is Sources of Strength. It's a program that we use across our district, and we use it because we empower our youth to support one another and be leaders for each other. And it's a strength-based approach because we talk about signs and behaviors to watch out for, but we also talk about how everybody has gifts to offer and everyone can make a contribution and be relevant and a part of the community. And so when you come together as youth supporting one another, that really resonates with them, and it just makes them stronger and stronger, and I have such excitement for all the good they're going to do. So thank you.
Dr. Crawford, thank you. You've been such a champion for mental health and peer support for our young people, so thank you for that. Let me turn it back to Roger for our polling question response.
All right, thank you, Commissioner. Again, we asked, based on what you had heard tonight, do you agree these proposals would positively contribute to the mental health work the county is already doing? 44% said you agreed, 25% of you were neutral, 19% strongly agreed, 8% disagreed, and 6% strongly disagreed.
Well, thanks, Roger. Thanks for letting us know that. That's going to be good information for us to help make these decisions, and I appreciate everybody who participated in that poll. Roger, do we have a phone question?
Yes, we do. Let's hear from Nej. I hope I pronounced that correctly. Go ahead, you're live.
You did, Brian. My name is, and I'm listening to this call, and I hear about all the funds that are available for grant proposals. I will say absolutely everything sounds wonderful, and we really want to help everybody in need. However, are we going to be starting new programs that are reinventing the wheel? For example, initial startup costs, I think, are all worthy of this grant money, but how does this affect residents in the long term? I mean, I know I pay taxes in Douglas County, and I'll say that this also hits close to home. I had a family member struggle with a health crisis who also died by suicide, and it was a serious mental illness. It was schizophrenia. And I guess I'm a firm believer that, went to NAMI, which is National Association of Mental Illness, with my mom, and we learned about how mental illness affects people in their lives. It was free. It was family-to-family support. And I guess I'm a firm believer that people helping people versus organizations helping people is often the most effective pill when it comes to giving and receiving support. And so I guess I just want to know, is this going to become, I don't want to duplicate things that are already out there. And I've heard great things about Arapahoe Douglas Mental Health. I wonder how this works there. And I just wonder about the long-term financial effects after the grant money is given.
You bet, ma'am. Thank you for that question. Thank you for the background of kind of defining your question, because I got to tell you, I really, the underlying concern in the background information you get actually was something I really shared. And I spoke about a little earlier, wondering what the heck are we doing with these issues? What business is that of a county government to put ourselves in the middle of? For a couple of these, I became a pretty big fan of the walk-in clinic idea, mostly because it fills a gap that we have here in the community. There are walk-in clinics like this, and Jen, correct me if I get this all wrong, but there are others in El Paso County, there are others in the metro area, but none right here. And so I felt this is worthy of consideration, if only for the fact that we're filling a gap. When we talked about the CRT expansion, Laura Cinconi mentioned it earlier. It was Castle Rock who did the first pilot program here in the county. I was on the Castle Rock Town Council at the time. My first vote was a no. And Jack Cawley, the police chief in Castle Rock, came forward and said, we need this. This is going to be an addition to the community. My answer was no. I wasn't a believer. It's within the first few months of that pilot program that we saw the results, and I became a believer and became an enthusiastic supporter. So when we had the opportunity to expand the CRT teams, the community response teams, I was an easy yes. I guess I'm confessing to that already, even though we haven't formally voted on this stuff. So that's where I believe everything you've heard tonight is worthy of consideration. It's filling a gap that we know is there, that we don't have the solution now, and our intent is to make use of this funding opportunity we got from the federal government to get these startup costs in, and then operationalize these programs with existing taxes as we move forward. I don't think we have no plans at this stage of the game to do anything to raise taxes or to otherwise take away a service so that we can do these things. So that's my answer. I turn it over to my colleagues and the other panelists to see if I missed something.
Well, I'll just add to that from a public policy standpoint. The commissioners are charged with the health, safety, and welfare of over 370,000 individuals, but we remain a fiscally conservative county. We've often said with ARPA funds, and again, this isn't general fund, this is $68.2 million in federal funding to recover from COVID. We want to be immediate and impactful, but we don't want to be duplicative and wasteful. So with these programs, we're not interested in growing government, but we are interested interested in convening partners to do good things that are impactful. And I'll just say the community response team, as an example, is a huge reduction in costs for our DA's budgets, our law enforcement budgets, for our hospitals when people aren't taken to ERs but instead diverted to care. So those diversions are actually a savings for our taxpayers.
So in closing this evening's conversation, I would like to say that I am very grateful for Barbara Drake on our staff who really brought all of these people together and helped solve the problems with people who needed care and there was no care for them. Dr. Barofio has joined in with Laura Cinconi and Maggie Cooper. The police departments have worked together. Let me just add that I started this journey working for the State Health Department researching homicide and suicide for 7 years. I read thousands of cases of suicides and homicides in this state. And the old saying is a problem well defined is half solved. Well, we can't solve the people who are taking their lives if we don't understand what's leading up to that. So Douglas County has been on the leading edge, won national awards for the work we are doing here in the mental health arena. And as the county coroner, I sat in far too many homes with families who'd lost a loved one and had no idea why. And that's why I'm willing to fund these programs, because they not only save lives, they enhance the quality of lives for those living with mental illness and those supporting them. So thank you to everyone who listened tonight. This is an important community conversation that will continue.